Hey guys, it's Shanna. I have Cam, who is one of my amazing friends in med school. Both of us are at UBC Med, going from second to third year. What are some things you've learned now that you're in med school?
Anyway, the most interesting part of med school for me was that it's no longer about competition early on, per se. I will say early on. It's more about the knowledge you gain. I think I went to med school with my pre-notions of I need to achieve 90 plus to be significant or like be doing well. But the truth is that's not how medicine is. It's not really possible for medicine for like you to have perfect diagnoses every time. Like it's not possible, right? Um, and I think med school is no longer about getting high grades. It's about obtaining knowledge for your patients, for yourself, so you can be a good practicing physician. It's no longer about getting high grades and beating your classmates at like an opportunity. It's more about, hey, I need to actually know what's happening because, you know, what if like a patient presents like this and I don't know what to do? Like, it's a life I'm playing with. So I think it was that kind of attitude for me to shift that. That was a bit difficult. You do your first exam and you're like, did not get 95. But you have to realize like, it doesn't matter. Do I understand what I was gonna do? What's happening? If someone comes to me like this, do I know what to do?
Mm-hmm.
That's what matters. But once you make that shift, you start finding what you like in medicine. Medicine is a very big field. It's not like you can just lump everything together. I have a passion, for example, for cardiology, let's say, but that doesn't mean I have to like every single aspect of medicine to like this one thing, right? I can just say, oh, I like this part of it. Not a fan of dermatology, for example, but like I do like this. So in medicine, you learn what you like and what you don't like, and I suggest highly that if you like something, shadow in it as soon as possible. Then you learn if you actually like the lifestyle of it or not, and like the daily tasks of it. So beginning med school, making that transition, and then there's a lot about professionalism you learn. There's a lot about responsibility you learn, and it may not seem like it may seem like a big deal at the time, but the more you go through, and then you start to realize that like you start waving a bit. You're like, I don't want to do this. I don't want to do that. But I think it's good to always have those principles in your mind that your profession is something that's privileged, and you should always stay professional. So that I think is a big deal uh, for me because sometimes I tend to be a bit more relaxed than I should be. So um, my goal was to always maintain that level of professionalism throughout. And they during interviews they kind of screen for that. They screen for professionalism. So if you're in med school, it's probably because you are a professional.
Actually, that's something I would comment on too. Like, I didn't quite understand why the MMI or like a lot of schools like they ask which ethics and like why that's a big deal. Because I was like, this is so obvious that the right thing to do is this. And so I was like, oh, that's like what? Like, why would anyone not do that? And now that I'm in medicine, I realized that the area is really gray. You know, I mean, there's the ideas when it's benefiting yourself for selfish reasons versus doing the right thing is that's usually clear, but it's usually doing the right thing for the patient is actually very ambiguous sometimes and is kind of on the brink of not doing well. And do we do this really invasive surgery that kind of helps, but kind of could also turn out well? And then you realize like there's a lot of these decisions that helping the patient is ultimately what you want to do, but these like very ambiguous things, or you know, things like the best thing for the patient, but the patient is struggling to afford this. Is that really the best thing for the patient? So definitely realizing through med school they're teaching us that there's a lot of gray, and making the best decision is really a judgment call that hopefully with experience and time and also just an element of sometimes we screw up and we don't make the best choice, unfortunately.
Right. There's no like umbrella guideline or like overlaying guideline that you always follow that's always true. Nothing in medicine is always true. I think every case is special. Every case needs its own consideration, and that's something you learn the more you do med school. But going back to my experience in, for example, first year, I think the first thing you want to do in med school is find a group of friends, because everyone's coming from various different backgrounds and everyone has different personalities. And it's a great time at the first 2 weeks. It's an exhausting time because you always have to like, oh hi, how are you? What did you study? Um, but once you find your people, it's good. Then you have your support groups instead, because med school will be stressful and you need your support groups, and use each other in a good manner. Be supportive. For me, like I found Shanna, for example, was a good friend of mine. Um, we also have a good friend group going on. And when it comes to the content of medicine in first year, um, it again depends on the university you're in. But what I found out was that the content of medicine for you should really start focusing on the clinical aspect of medicine. And a good thing that I highly recommend to everyone who starts med school is to have a good set of electronic notes you can refer to. That is probably a device given to me too late. But yeah, handwriting notes, absolutely the best thing, but you should have a set of electronic notes to refer to in the future, because you will need it in the ward.
I regret that too. My first year notes are a mess and they're not organized and I can't reference them. This is very bad. Don't do that.
It is very bad, yes. I have books of notes that are lost all over my house. So don't do that. Um, the third thing I would recommend, the third thing, continue your passion,
Mhm.
right? Don't drop everything for the sake of medicine, because you would, like, medicine's good, but you still need some part of your life that's not only human, but also like you need to follow your passion to develop your own personality, develop your own separate skills from medicine. And it stands you out. If you ever do interviews and something like that, then you won't only be known as the person who's a medical student. You'll also be like, oh, I also did this, which is part of who you are. It expresses.
So by
Um,
passions, what do you mean? Like a hobby? Do you mean research? What do you mean by passion?
so I think it really depends. I don't think it would fall under hobbies. Hobbies is something you should have separately that just brings you calm and relaxation and joy.
Mm.
It's a way of stress relief, basically, or live life. And what I mean by passion is something like research, something about advocating for a population, something like volunteer work,
Mhm.
for example, getting involved with church, like stuff I mentioned before. I think that's something that you should still continue doing. I'll bet that you won't be able to do as much as you could in undergrad, probably. But even if it's your passion is to like basically shadow a lot,
Mhm.
do that. I again started doing research because I love research, but there's a lot of people who do all kinds of different things.
Mhm.
I had a friend whose passion was exercising, so they develop all kinds of exercise programs for med students, or they did some research in exercise, for example. So, they went into a club that did a lot of like research, or made their own club that did a lot of exercise. Yeah, the responsibilities is a lot. Like we're talking about, like yeah, do I'm telling you to do a lot of things, like go spend time with your girlfriend or boyfriend or paramour. Spend time with your friends, spend time with your family, do a lot of research, do a lot of your passion stuff, do a lot of studying. There's a lot, right? But that doesn't mean do everything at once at the same time.
Mhm.
You can always be like, this month I'm gonna do this, this month I'm gonna do this week I'm gonna do this, next week I'm gonna do this, right?
Mhm.
Um, just remember that you don't have to always be doing everything at once. Is you can just do one thing and then stop it a bit, and do another thing and then stop it a bit, and do another thing and stop it a bit.
No, I think
That'd
that's
be
really
my
good.
advice.
Yeah, because I remember when I started med school, I thought I had to be everything at once. I had to be fed and I had to get my research going. I also came in with you. I was like, I have to do really, really well. And when you try to do everything at once, things crumble because it's just not working. And so I like your analogy of this, like things different times, different things are the priority.
This one thing I want to mention. There's this notion in med school that everyone's trying to compete with you and beat you. No, there isn't.
Mhm.
um, it doesn't really matter at first, as long as you follow what you like. Don't think about what other people are gonna do or what other people like. focus on what you think is something you should do.
Mhm.
And um, med school becomes a bit competitive towards the end of it when you're doing your cons and stuff. In Canada, but well, I haven't done that yet, so I can't really comment. But what I've been told is that you should just be yourself and do what you think is right, and find your group of friends to support you.
Yay. Thanks so much for your time, Cam.
Of course.
So I guess if you had any questions that came up because of Cam, leave them in the comments below to redirect them to Cam. And then hopefully like, subscribe. And then this was Cam and this is Shanna. So thanks guys. And now
Thank you.
in.